So this is a new virus that has emerged on the world stage. None of our bodies have ever seen it before, so none of our immune systems recognize it as a threat. And whenever a new virus comes on board, or a new bacteria, our bodies don't recognize it as a threat, and therefore we have no protection against it. Therefore, the two things that are most important about the characteristics of a new threat are how fast does it spread and how deadly is it going to be. And this is what is still emerging, so that we don't yet know how fast and how wide this is going to spread, or how many people this is truly going to harm. So from what we know so far, for the people that have gotten sick, and unfortunately for the people that have succumbed to this disease, it appears to affect older individuals and individuals that have respiratory or pulmonary problems. The virus causes a pneumonia, so anyone that has a compromised pulmonary system or an immune system that is not able to mount a response appears to be most affected, and that appears to be those over age 60 or those with a pulmonary problem such as COPD or asthma. So I think there are three things that are underway that people are seeing in the news. One is kind of individual action. We can each individually take action to limit the likelihood that we're going to contract the disease by hand washing, by avoiding handshakes, by doing the elbow bump, by doing other things, not going into large crowded areas where you're more likely to be exposed. So those are individual actions that people can take. Then there are collective actions that institutions can take, like avoiding large crowds. And that's where we have seen, unfortunately, the cancellation of our SEC basketball tournament, March Madness, the start of the baseball season, where large crowds would come together and mix together and potentially expose each other to this new virus. And then finally, there are public health strategies that the health arena is putting in place. We have moved from contagion, where we were trying to quarantine everybody, to now we're trying to slow the spread, mitigation, so that as the spread of the virus goes, we have time to develop new treatments or potentially a vaccine that's still months, if not a year or more away. I think the medical community and the public health community and obviously the business community are rattled because of uncertainty. We don't know how far and wide this is going to spread. We don't really know how deadly it's going to be. We have to prepare for the worst case scenario, and we have to take actions to try to make that worst case scenario not come true. That's where our individual action, our collective action, and the public health strategy becomes so important for us to implement as an entire citizenship. It can't just be a few people doing it. We all need to take those steps. So there are two issues around a virus that are important. It's how fast it spreads and how deadly it is. The more deadly a virus is, it doesn't have the chance to spread that fast. The faster a virus spreads, the more people it will affect. It looks like this virus is somewhere in the middle. And I think we can anticipate over the coming year or two that most Americans, most Arkansans, will at some point be infected by this virus. But what's important in the short term is to keep it from harming those individuals that are most susceptible, our seniors and those with respiratory conditions, while we try to develop treatments and hopefully someday a vaccine that we can use to prevent this illness from even starting to have the infection.